Other than skin cancer, prostate cancer is the most common cancer in American men. It can be a serious disease, but with early detection and advancements in technology, the good news is there are many treatment options. Board-certified radiation oncologist Dr. John Eink of the Moores Cancer Center at UC San Diego Health is joining us to share options to effectively treat the disease while minimizing side effects. Welcome, Doctor.
Thank you, Laura. It's a pleasure to be here.
Doctor, how common is prostate cancer?
Well, as you pointed out in your introduction, prostate cancer is very common in American men. There were over 180,000 cases of the disease last year.
In terms of treatment, there are a number of options. Tell us about them and their possible side effects.
It's important for patients to know that the vast majority of prostate cancer nowadays is highly curable with whatever treatment they choose. They can choose from active surveillance, from surgical removal of their prostate, or from various types of radiation therapy.
As an experienced clinician, have you seen any recent advancements?
I've been treating prostate cancer for 25 years, and I will say in the last 5 years, I've seen more advances than any other time period. We've improved in our ability to more precisely target the prostate gland, to deliver higher doses of radiation, and to reduce the dose to the rectum with devices like SpaceOAR Hydrogel.
Now, why is SpaceOAR Hydrogel an option patients should consider?
Well, SpaceOAR Hydrogel allows us to increase the distance between the prostate and the rectum. The larger the distance, the lower the dose of radiation that's going to be given to the rectum. And that's going to reduce their risk of rectal damage. Historically, radiation has gotten a bad reputation for causing rectal bleeding or causing other types of rectal symptoms like more frequent bowel movements. By reducing the dose of radiation to the rectum, we can better preserve these patients' quality of life.
Tell us how and where the procedure is performed.
The procedure's done right in our office. It's a minor surgical procedure where patients just take an oral analgesic before they come in. We use numbing injections to make the procedure more comfortable. And the recovery period, the procedure itself takes a half hour. The recovery period is about 15 or 20 minutes afterwards.
Now, it's important to note that this is not a one-size-all treatment option. Who would be the ideal candidate?
Good candidates for SpaceOAR include patients with early-stage prostate cancer that has not yet extended outside of the prostate capsule.
And is SpaceOAR Hydrogel covered by insurance?
SpaceOAR Hydrogel is covered by Medicare and most private insurance companies.
It must be gratifying to have SpaceOAR Hydrogel as an additional weapon in your arsenal to fight the disease and offer to your patients.
It's all about quality of life for any of our patients. That's why the choice of treatment for many of them can be so difficult when they're weighing surgical removal of the prostate toward radiation treatments. And I think SpaceOAR really makes it easier to talk about radiation nowadays when I can feel comfortable with that we're reducing the risk of rectal damage as much as we possibly can.
Now, you've been using this treatment for a few years now. Tell us what your patients are telling you.
I've been using SpaceOAR Hydrogel for approximately 3 years now. And in following my patients, they're thrilled that they do not show any signs of rectal damage and that they had this available as an option to them.
To learn more about SpaceOAR Hydrogel and to find a doctor near you, visit SpaceOAR.com. Doctor, we thank you so much for sharing this important advancement in men's health.
My pleasure. Happy to be here.
And we thank you for joining us on San Diego Living. We'll see you next time.